Now, Thapelo, good evening. Thanks for joining us and a warm welcome to the late edition. First of all, around 600 intern pharmacists and other health professionals are now in limbo. So from your engagement with the affected graduates, what does this decision mean in real human terms, financially, professionally and psychologically?
Okay, no, thank you so much for the question. So basically what is happening with the decision that the Department of Health KZN has taken is that they have shifted the projection of academia for all interns that are there currently. If you know that we've got 4 years of academics within the university, then you've got a prerequisite that is put by the very same government that says they don't have the budget, which is internship and ComServe. So now if they say that they do not have budget for internship, one cannot be a fully fledged pharmacist. So this prolongs everything. And now we've got families that are depending on us. And besides families or anything else, is that now we are speaking about patient safety. You know, we believe that without pharmacists, patient safety is compromised. And when we took an oath as pharmacists, we took an oath to make sure that we took an oath to make sure that our communities are always at the center of the best and effective pharmaceutical care. And now since it's not happening, we are enraged, we're upset, we're angry, we feel disrespected as pharmacists and the whole pharmaceutical fraternity.
Now, Thapelo, for young pharmacists, I mean, internship is a legal requirement to practice. So by halting these placements, isn't the department effectively putting careers on hold indefinitely?
They are, actually. They're putting careers on hold, and while putting careers on hold, they're actually compromising the safety of the community members that they claim to serve. For example, if you know that the 6 priorities of the ministerial priorities, the top 2, number 1 is patient safety. Secondly is patient waiting time. You are neglecting those main points by not hiring pharmacist interns and prolonging their careers and actually halting their careers for lack of a better term.
And who is being the hardest hit by this decision? And does it risk possibly entrenching inequality by pushing only those with the financial means to survive the delay?
Yes, our pharmacist interns, actually the pharmacy profession as a whole, you know, we work like cogs, you know, in chains. So you need interns to work effectively. You need ComServes to work effectively.
Yeah.
You need your grade 1s, your grade 2, your grade 3s. So now you are minusing one important group within the chain, and you expect you expect the groups to work effectively. It doesn't work like that. You know, we need our interns, we need our ComServe, we need everyone. And obviously, you know, you've got your interns that have been depending on NSFAS. You know, on aid, some we've been giving them money throughout the whole year, thinking that, but now they'll be working, but they're not. You know, now they must go back to their communities with nothing in hand. After 4 years of hard studying and hard work, it's disheartening to say the least. And we believe that the KZN Department of Health should do better and must do better.
But Thapelo, the department blames the severe budget constraints linked to National Treasury austerity measures. So at what point then do these cost-cutting decisions become a threat to public health? And how much of an impact does this have on the local clinics and the hospitals, in particular in KZN?
Okay, so let's first attack the budget constraint. The budget constraint should affect everyone.
Okay.
You know, everyone that is involved. Now, there's a budget constraint that only affects pharmacist interns. That makes no sense. So if you have 100,000, if you had 100,000 last year and you were able to fit in pharmacist interns and all other interns that are there, and this year you have 50,000, you should budget appropriately and make sure that all the sectors of health are well represented. And if people do not know how to budget and they want cyber to assist them with budgeting, we're more than capable of going and assisting them with budgeting and say, no, since you have so much, this is how much you can give to pharmacist interns. Because according to my knowledge, you know, I can always be corrected. There are 2 interns, 2 types of internships within the health fraternity. One is the medical doctors, 2 is pharmacists. So you just have to divide it by 2. I don't know what maths and what budgeting they're struggling with, but we're able to assist when needs be.
Isn't it a false saving? Isn't it a false saving to sort of freeze the internships while public facilities already struggle with medicine shortages, with the long queues and overworked staff?
It actually doesn't make sense. It doesn't make sense at all. Already, pharmacists are short-staffed as we speak, right?
Okay.
And usually they use interns and concepts to try and supplement for the short staffing. Now you have a situation where now they're saying, no, we don't even give you anything to supplement with you guys. And we're going to hire medical practitioners. We're going to hire the doctors. We're not going to hire the pharmacists. So what essentially is going to happen is that within the OPD of the clinics, the doctors, the line will go smoothly. But once it gets to the pharmacy, it's going to slow down drastically. So in a situation where a patient would usually wait for an hour, now they wait for 3 hours, and they would blame the pharmacy. But in essence, we are short-staffed and we are not taken seriously. No, we're treated like children of a lesser God, and we're not children of a lesser God, and we don't want to be treated with such disrespect from this point going onwards, because we feel like we've been letting these things happen, and gradually it has come to this point, and to a certain degree, we are to blame for being mute when we are seeing this injustice happening, and it stops now.
And has the department shown you guys, the association, the actual budget figures that actually justify this drastic move, or is it budget constraints being used as a blanket excuse?
It is definitely a blanket excuse. We've never seen such budgeting, and hence if we'd seen, I think you and I would be speaking figures right now. I'd be telling you there's so much, we can do so much. It's an excuse, it's an excuse. Maybe there must be austerity measures here and there, but you've got two professions that you need to consider, and you're only considering one. And in any health department or component where only one profession is considered over the other, it's even going against the World Health Organization, because they always advocate for a multidisciplinary team. They always tell you that no profession is an island. Pharmacists work with nurses, nurses work with doctors, doctors work with pharmacists. So now you are only prioritizing one and you are letting the other one out to dry. So it's definitely a blanket excuse, and we're not taking it, none whatsoever.
All right, Thapelo, great chatting to you. Thank you so much for joining us. We do appreciate your time. That was Thapelo Malatji from the South African Young